Welcome and thank you for joining us today. My guest is Missy Plor-Memming, the Senior Vice President and Head of National Accounts for the U.S. Region Group Benefits at MetLife. Missy, thank you so much for being here today.
Thank you for having me. I'm super excited to be here.
Absolutely. So Missy, for those in our audience who may not be super familiar with MetLife, can you tell us a little bit more about your mission and what sets you apart in the federal insurance marketplace?
Sure, I would love to. And thank you for having me today. It's exciting to be here to talk about employee benefits. So MetLife offers non-medical health benefits in the U.S. So think of that as life insurance, dental insurance, vision insurance, and supplemental health benefits like pet insurance and legal coverage. And we actually offer that to about 50,000 group employers that cover about 40 million employees and their dependents. And we have the privilege of caring for those folks every day, and we take that privilege quite seriously. Our philosophy around what we do is always with you, building a more confident future. And that philosophy guides everything we do, whether that be from the capabilities we establish to the plan designs we work with employers on, to actually how we execute and deliver service. And I've actually had the privilege of leading our federal government team for a long time, and we work very closely with OPM to curate benefits that are meaningful to the lives of the federal family.
Yeah, absolutely. I think that idea of holistic health, I love that you brought that up because I feel like that is something that's just coming much more into the conversation these days in the health insurance marketplace, in the health insurance space. So can you walk us through, for MetLife specifically, what are some of the options for Plan Year 2026 that incorporate that idea of holistic health or beyond just physical health?
Yeah. It's a great question. So we work very closely with OPM, who thinks, they think very critically about how do we create and craft a set of benefits that really care for federal employees. And they take that responsibility seriously. And as our customer, we take that responsibility seriously. Our philosophy is centered around this model of care. So as we think about 2026, so we work very carefully with OPM this year, whose focus, by the way, is around holistic health and well-being. And we work to really craft some plan design changes that make sense in the context of the modern workforce, including offering 3 cleanings for people who are pregnant or have diabetes. But it's also things like legal insurance and pet insurance, right? The family continues to expand, right? People don't just think about their family anymore as me and my partner and my kids. They think about it holistically. And then you bring in those elements of financial health and mental health, and you can really craft a bespoke set of benefits for your unique circumstances from the offerings available through OPM and as a federal employee and a member of the federal family.
And looking back on really just this year for federal employees, it's been a little bit of a unique year, so to speak. There's been a lot of changes going on in the federal workforce and in the government. So maybe in the health insurance lens with that, there's potentially a need for more flexibility, more support in that space. What does MetLife do to try to support or deliver on that aspect?
Sure. You hit it, Drew. When you think about the federal employee programs, right, the federal government continues to change. Think about demographics alone, right? A lot of longtime federal employees are retiring or leaving and being replaced by younger people. So what is important today is different than what was important 20 years ago when we started the FedVIP program, which was, of course, appropriated by Congress in 2006. And so when we think about the program benefits today for 2026, we think about flexibility and expanding that program, and it takes 3 dimensions. First and foremost, we've expanded the dental benefits available. So as an example, we are covering a 3rd exam if you are pregnant or you have diabetes. From a clinical perspective, both of those conditions warrant an additional cleaning during that period of time. In addition, we actually are doing something really unique for 2026 from a MetLife perspective, in that we are offering a focused exam. So as an example, Drew, if you go home tonight and you crack a tooth, or you're like, wow, I have a toothache, typically you would go to the dentist and your dentist would give you an exam, and it would go against your annual exam benefits. So the next time you needed an exam, it would cost you more from an out-of-pocket perspective. We don't want to provide that kind of care. We don't want to provide that kind of benefit where you are utilizing your annual exam benefits. So instead we said, if it's a focused exam, like a toothache or a cracked tooth or something, you can go, that can be 100% covered, and it won't go against your annual exam benefit. In addition, we're thinking about things like the network. How do we make sure we have the most expansive network, both for dental and vision? So think about that same model of care and benefits available in vision. Vision has no co-insurance for things like exams, so it's really affordable to go get the eye care you need. And it's backed by a strong network of both independent providers, as well as for vision, places like Costco and Walmart and Sam's Club, right? So we want to meet people where they are in their time of need and in the place that they believe they can get the best care. And then we're wrapping all of that with other value adds. So as an example, anyone in the federal family who enrolls for dental or vision can actually get identity and fraud protection at no additional cost. We actually rolled this out a couple of years ago in response to the 2022 and 2023 ransomware. And now it feels like there's a breach of some sort often. And so we want the federal family to have the protection they need. So if they enroll in dental and vision, they get this identity and fraud protection at no charge.
So just given that there is so much information out there, as you kind of exemplified in just the last couple of minutes that we've been talking,
Sure.
What would you recommend to federal employees heading into open season this year? What should they be looking out for? What tips can you give them?
Yeah, it's a great question. I believe, MetLife believes, first and foremost, it starts with education. So OPM has curated an incredible platform of benefits available to you. Educate yourself on those benefits. The average employee spends 7 minutes looking at benefits that will literally impact your financial outcomes for the next 12 months, right? Whether it be in out-of-pocket expenses or premiums, probably warrants more than seven minutes worth of research to do that. So spend the time educating yourself. What benefits are available to you? Then look at your family circumstances. What did you spend last year in medical costs, dental costs, vision costs? What would you expect them to be in 2026? Do you have a child who is reaching that age where they're likely to need glasses, as an example? Maybe you didn't enroll in vision benefits last year, but with that, you might want to enroll in vision benefits. So think about your family circumstances. And then third, go beyond the premium cost. So, if you go to Benefeds, you can see the premium for a given product. But what's really important is, what does that premium get you? So OPM, again, is curated that, like for dental, preventative services are covered at 100%, and all carriers abide by that. But then the co-insurance levels can differ. So co-insurance is the amount out of pocket you have to pay when you go see a dentist, as an example. But every carrier negotiates different fees to reimburse the dentist, and then your co-insurance is applied against that. So when you go through Benefits, go to the carrier link and look at, what's a root canal going to cost me if I have to have one, or what's a filling going to cost me if I have to have one, and do some comparison shopping. Because if MetLife's negotiated discount for something is $50 and someone else's is $100, you apply 30% against $50 and $100, you're going to get very different financial implications. And then when you estimate your out-of-pocket expenses plus the premium that comes out of your paycheck, you can really get the true cost or the true value of the program.
Great. Well, Missy, it's been great talking to you today. Thank you so much for joining me.
Thank you.
Missy Plor-Memming is the Senior Vice President and Head of National Accounts for the U.S. Region Group Benefits at MetLife. I'm Drew Friedman, and you're watching Federal News Network. And now we'll go back to the studio for more on the Open Season Exchange.